Hello, and welcome to the Florida Nurse Practitioner, ranked as one of the best medical podcasts in Florida. This is the official podcast of the Florida Association of Nurse Practitioners, the premier APRN advocacy organization in Florida for all nurse practitioners. If you are not a member, you should be. Join today. Just go to flanp.org and click on the red box, Become a Member Today. Members get all kinds of perks, including discounted CEUs, including autonomous practice recertification CEUs, insurance discounts, free monthly CEUs, and plenty more. So join today and make your voice heard. Help us help you. We are here to support all APRNs in Florida to practice to our fullest ability of our education and elevate the APRN profession in Florida. I'm Paul Bond, APRN, your host for this show, and I want to thank you for listening to the show and helping make it one of the 10 best-ranked medical podcasts in Florida. And on today's show, we have another roundtable discussion between myself, the president of the association, Lon Ratner, and one of the district directors and current treasurer, Vernon Langford, this time concerning titles, education of the general public and our peers on APRNs, NPs, what we can do, what our role is, and those types of things. This was a wide-ranging discussion that touched on both education of our peers, the other people in our profession, as well as education of the public. So I think this is a discussion that needs to continue. I think this was a good starting place for this discussion, but I think that we as a profession, the nurse practitioner profession in general, have failed at our messaging to the general public on what nurse practitioners are and what we bring to the table and what we can do for them. And we need to start changing that discussion and look at things a little bit differently. And that's what this roundtable discussion was about. So have a listen and see what you think. All right, and I'm here today again with Vernon Langford and Lon Ratner, both board members of FLANP, Lon being the president, and Vernon being a regional director and currently the treasurer for the board. So, gentlemen, thank you again for giving me some time to interview you on some other topics.
Thank you for having us back.
Indeed. It's a pleasure to be here. And today, we're going to discuss kind of briefly, because this can be a long, winding kind of days-long discussion, and it's something that has to be worked out ultimately at a legislative level, but our thoughts on national certification versus state licensure, specifically in Florida, and what being an APRN means. Lon, I'll open it up for you first. What to you do you see as an APRN? What does that mean as opposed to a nurse practitioner?
Well, I'm not going to jump into the verbiage that's on the website or in our book. To me, an APRN is Advanced Practice Registered Nurse, and it seems the word NP, nurse practitioner, is more of a slang term. The terminology, when I speak with my patients, they have no idea what's on my shirt. It says DMP, MOUSC, and whatever it can say, and they have no clue. But they go, "Aren't you a nurse practitioner?" Well, yeah. And that's what I'm seeing as a big continued. Again, last time we spoke, we were talking about the disaster that had happened with the state and with the hurricanes. They knew we were practitioners, nurse practitioners, and that was a good thing. But they had no idea when I mentioned, you know what an APRN is? Just a sidebar, and they're coughing and hacking. No idea what the hell that is. Okay, I understand that. And I moved on. So kind of in a random poll, with the people that I've been speaking to today, and such, I'm finding people still are not understanding or know that an APRN is a nurse practitioner, and whether or not do we want the slang word nurse practitioner? Do we want to make it more official, or do we want, since the state assigns us the APRN title after completing schooling, what exactly do we want to do going forward with this? This titling is getting very difficult and confusing for people.
And I would add to that in looking at it, we go to school to become one of the 4 roles that fall under APRN. So APRN is the license that you'll receive. So what happens is you will go to the Florida Board of Nursing, you'll get licensed as an APRN, and you can be a nurse practitioner, a certified registered nurse anesthetist, a clinical nurse specialist, or a certified nurse midwife. Now, all 4 of those are all APRNs. It's just a matter of which one you have the qualifications and education for, and then you're licensed. So oftentimes you will introduce yourself. Hi, I'm Vernon. I'm your nurse practitioner. You don't really say I'm your APRN. So I think that's where a lot of the confusion starts. Right. Hey, just heads up. I'm on call. I got to take this call.
And I agree. Go ahead, Vernon's got to step away for a second. And I agree. Another thing I wanted to add was, you introduce yourself. I say, hey, I'm Dr. Radner. I'm Dr. Law, and they like that way. The nurse practitioner. It's just one the same thing, the nurse practitioner. And this is in an effort to ensure they know the nurse practitioner. Maybe I'm shooting myself in the foot. Hey, hey, I'm Dr. Law, I'm Dr. Ratner, APRN. And they're going to look at me and go, what the heck is that? And that's what's happened also when I've tried them both. So I don't really know, what's better. They're comfortable with the other term. And then I sit a whole educational time telling them what is an APRN. And it goes back and forth with the patients. And obviously we do the care. We have to care, and we do our treatments and all, and we sign. And again, I write out that word autonomous every time, and then I get the phone call. What do you mean? What's an autonomous APRN? I thought you were a nurse practitioner. That comes from the pharmacist sometimes. And right. You sit there re-educating. So it's kind of like maybe we need to kind of consider looking at, when I say standardizing, I mean using the same terms as standardizing, but do we make it official? Do we not make it official? Everyone likes nurse practitioner, then maybe we need to kind of do the same thing so everyone kind of recognizes that as, and then eventually we can turn to teaching other things.
Well, and I think also educating everybody, because physicians are in the same group. They're in their own little world, and that's not a negative. It just is what it is. We're in our own little world, and that's not a negative. That is what it is. We know our titles. They know their titles. They may not understand ours, and we may not fully understand theirs. Just as with pharmacists, I think it's important that we educate, in general, the public, people outside of the nurse practitioner profession. What does APRN mean? It is synonymous with nurse practitioner because it's part of the title, basically. Advanced Practice Registered Nurse is a nurse practitioner. But then the different levels of certification based on your education, not your licensure. Because just looking through, just from AANP, there's family nurse practitioner, adult gerontological primary care nurse practitioner, emergency nurse practitioner, and psychiatric mental health nurse practitioner. Then you go over to the ANCC side, which is the American Nurses Association, and they have another full list that includes those 4, but many more. And the way a lot of state legislation is written, we have to put our title on our marketing, whatever we do. So on our shirt, jacket,
clothing, exactly,
whatever it is, we have to put FNP or AGA-CNP or PMHNP, and that can be confusing for people too. So maybe standardizing a way that we all say to people, I'm your nurse practitioner. Oh, I understand that. Okay, great. But then educating people outside of that, what these different things are and what our capabilities are. Because I don't see the general public, by and large, and there are a lot who do. I don't mean to belittle anyone, but by and large, the general public sees us as nurses at some point.
Correct.
And while we are all registered nurses, there is more to it than we can do past, and I don't mean to belittle nursing, but past just what registered nurses are allowed to do. We have advanced skills and we have advanced abilities. And I think that's where we, the nurse practitioner profession, have failed in educating people what we do compared to nurses.
Well, and I agree with that. And I think we should reconsider looking at the different avenues and how things are being written. And it's confusing, really. I mean, but example, those that have the masters are MSN, FNP, be it C for certified or BC. And then it can be as simple as an MSN, because you got to have a BSN and an MSN, as I understand still. And then FNP, and then whichever testing you took. Or if you're a DNP, it's a DNP, and no one knows what that means either. NPC or NPBC. It's as simple as that in those standardizations, and when you look across the realm of how to and what's appropriate and stuff like that, you try to put your highest degree if you choose. And I think the randomization of what you choose, which is in the literature and how you want to state it, is what becomes a little more confusing, or even more confusing. Another one may put MSN APRN, and they're going to look at you and go, huh? And really question it. A lot of us will put in our doctor, our name, then DNP, which is redundant. APRN, autonomous APRN, which kind of adds a whole little sliver of how do we abbreviate autonomous. Do we not? But I wonder, and then educate, and just the more they see it, the more the population sees it, might be the more it's accepted. NP is just accepted across the board. So do we want to turn that around to say, well, we're going to encourage you not to use the word nurse practitioner as much as what you really are titled, so people learn? You still can use the terms, we're not questioning that, but and use any term and bell and whistle you want. So what might be the better way of doing it? I have so many thoughts, and we all have a lot of credentials, and we just don't want to confuse the people when you see others simply putting, when you graduate, you get FMP if you're FMP, and that's it. Nothing more, nothing said. Or you got DNP. If I just wrote my name DNP, no one would have a clue what I'm talking about.
Right, but they would understand if you wrote your name and wrote nurse practitioner.
Correct.
So maybe the better option is to go with what they already know. Start just like when we're dealing with patients, educating them or whatever it may be. You meet them where they're at. So instead of trying to teach them to unlearn things to relearn new, start with the general base. Okay, the general base, for the most part, is the general public in the United States understands what a nurse practitioner is, or understands the term nurse practitioner. So maybe start with that as the educational base. The nurse practitioners are all of these other titles and all of these other alphabet letters after our names, but we're nurse practitioners, and nurse practitioners can do A, B, and C.
True. I'm thinking of meeting where they're at's a good point. I guess I'm looking at, is it? I'm not a big title person. If you're, let's say like master's level, agreed. DNP. Would you write doctor, your name, and DNP, nurse practitioner after all that? Is that what you're suggesting?
I think you can write anything you want. I think is what the general public needs to understand. You are a nurse practitioner. Period.
Done.
DNP, MSN, PhD, MOUSE. You're a nurse practitioner, and this is what a nurse practitioner can do. And I think starting there and saying nurse practitioners are advanced nurses with training and education to provide, and this again comes down to state statutes. In Florida, we provide medical care.
Right.
In California, they can't say that. They have to use other terms. But in Florida, nurse practitioners provide medical care.
Which is a problem that the physicians have always discussed.
Doesn't matter what the physicians have a problem with. We are educating the public what nurse practitioners do. Nurse practitioners provide medical care. Period. Because ultimately, that's what we do.
Of course. So I'm like, again, so it brings it back to the issue of having them know, and do we keep, when you're writing on your jacket, your shirt, whatever you want to write it on. Because again, those educational degrees, the DNP, the MD, the PhDs, etc. I guess it sounds almost like you don't want an ego, but you want people to know what you do and what you, who you are and what you do.
Right, but the problem comes in that becomes more confusing for the general public. So the basis of what we want to try to accomplish is to educate the general public on what nurse practitioners are, on what advanced practice registered nurses are, regardless of what the title or all those educational things are. What is a nurse practitioner? A nurse practitioner is a registered nurse with advanced education and training to provide medical care in the state of Florida.
Right. Done. Maybe it's that simple. Maybe it's too simple.
It is that simple. It is that simple. Why make it more confusing?
I don't understand the reason. It is what it is. And so Vernon's going to come back. He has to step out for a few minutes. So I wonder, as an organization association, what do they, as our organization goes forward, do we want to, quote, I'm using the word careful, standardize how we use it so that everyone recognizes, that, well, shoot, all those FLAMP people, they just use one title. Maybe. Being careful in saying that. So we kind of set the bar in that we're asking all the members to consider using this standard. And that may be exactly what
to a point, I think having a standard way of writing things out, but past the writing, because people don't read discharge paperwork.
Mm-hmm.
So you can write whatever you want. It's what you tell them and what you educate them in person that's going to be the difference.
Well, I agree there.
They aren't going to care. They aren't going to care what letters are after your name or what they mean. Who cares?
Well, yeah, but I think
what's in it for me is with it. Right, but the question comes down to, why doesn't the general public understand what a nurse practitioner is?
Because we don't educate them well enough.
Because we have focused on what we think we are, as opposed to what's in it for me from their standpoint.
Correct.
What do they get from us? Not what are we giving to them. What are they getting from us? They're getting medical care from us.
Mm-hmm.
They don't care that you're a DNP. They don't care that you got all these other words after your name. That's immaterial to them.
But isn't there a ruling? I think there's a rule in a law. I'm sorry to interrupt you. I apologize. Isn't there a concern, or is it just it's not a law about there's been fights out in California. There's been fights all over about the term medical. So I'm very careful if I even try to use the word medical. You mentioned medical, and I know what our law states, but apparently there's a lot of flack, and when that comes in, we don't want to get people to get into these legal battles. We want to kind of set the bar and move forward. And I'm not saying that we shouldn't use the word. By the same token, we're permitted to use that word, medical.
We're saying the truth. In Florida, which is as far as we can go, nurse practitioners provide medical care.
Right.
The legalities of what you write are something totally separate from that discussion.
True. I'm following you on that. Okay.
So educating the public, we provide medical care. What else? I mean, how else?
We provide nursing and medical care.
We provide medical care. We're advanced practice registered nurses, nurse practitioners. We come from a nursing background and provide medical care.
Understood. That's not a question. I hear you.
Right. We use our nursing education in doing that, but we're not providing just nursing care because there's more to it than what we do. Right.
The law. So then, how would you?
Forget about the law and writing things down. That's not what this discussion is. This discussion is, what do nurse practitioners do for their patients? How do we educate the public to understand what a nurse practitioner is and does, not what we write on a piece of paper?
Mm-hmm. And that's kind of where I thought one of the two. That's why it's two separate conversations.
Right, because what we have to write is already in law. We can't debate that. We can't discuss it. We can't argue it. We can, but it's not going to change the outcome. We still have to do what the law says.
So then to move on, move a little forward on it, because we're agreeing on it, and I see the organization in a positive fashion going forward. How do we as the organization necessarily move forward? And the way I see it is that's going to become more marketing, more podcasting, more general information that the actual members will utilize. Maybe it's going to be a breakdown of what the law states, maybe a preamble of what the actual state regulation is. So,
right, but how better do we educate the public? Because the public ultimately is where we're lacking in understanding. All of us as nurse practitioners understand what we can do. We understand the law of what we can write. We understand what we're allowed to perform. For the most part, I mean, there's always going to be outliers, but for the most part, nurse practitioners understand our role. How do we teach the public what our role is? What our role is, not what our educational degrees are.
I'm listening, right?
So,
how do we get the information out to the public?
I think is the basic question: is what do we tell the public that our role is as nurse practitioners?
What the law says. That's it.
Which is, we provide medical care.
Done. But now, okay, that's it. That's the answer to the question. I think we have solved the answer to the question.
Right, but again, how do we get that out to the public? What's the best way that we as an association can take that on? Because we as a profession for the last 50 years have not adequately done that education.
Right.
We've done a lot. Nurse practitioners have done a lot and come a long way, and we have educated the public in a lot of ways about what we do. But there's still a lot of lack of understanding of nurse practitioner versus nurse. So how do we change that perception?
I think it's a two-step process, maybe even a third step. Step one is we as the professionals in the field have to understand what we are. Maybe part of the preamble for all of us is what the law is. If we understand it and we talk that talk, that might be the step one, because we all don't say the same thing. We need to say the same thing. Or at least, again, we all say, hey, I'm Dr. Law and I'm a nurse practitioner. If we get our own to state the same thing, that's one avenue for us all on the same sheet of music, if it can happen like that. And then those people that we're talking to are learning the same thing. On the second fold of it, that's where I guess the marketing. One, we have it on our letterhead as what the law or the rule is. And then two, we're actually talking the talk. And then getting out to the public is going to be through the avenues of marketing and demonstration in the sense of doing it. So they're hearing it, they're seeing it, they're hearing it from us, they're seeing it from us. And then join with A&P National in assisting and educating the public on that specific component. I like that. I like the idea of, knock on a door, build a sign. I mean, we can do all those things too, but I think it's really because we are educators by trade, and by what we do is we teach the patient also. So,
yes, and ultimately that goes back to our nursing background. And I say that because back when I was a neophyte paramedic, actually working in the emergency department, I learned from diploma nurses who, to this day, I say are some of the best nurses I ever worked with.
oh, most definitely.
That the only difference between a nurse, a registered nurse, and any other professional in healthcare is nurses educate, and that's the biggest difference. So you're right in saying, yes, we educate. And that's what I think we're failing as far as what nurse practitioners do. Just as you were talking, I decided to pull up, I decided to do a simple search on what is a nurse practitioner. And here's from Cleveland Clinic. Okay. A nurse practitioner, or NP, is a nurse who has advanced clinical education and training. NPs share many of the same duties as doctors that should be physicians, which is a totally different
problem right there.
discussion. They perform physical exams, diagnose and treat diseases and other health conditions, and prescribe medication. A nurse practitioner must have a graduate level degree of education. So I think that statement, with changing doctor to physician, because doctor is an educational title, not a licensure, I think that statement is what we, in general, nurse practitioners, should start using and saying. Nurse practitioners have advanced clinical education and training, perform many of the same duties as physicians. So we provide medical care just as physicians provide medical care.
So I'm going to comment because you did some research right away too. I just jumped on, happened to find UCFs. NPs fall into the advanced practice registration nurse, APRN, which means they hold the degrees at either a master's or postmaster's level, claim a specific expertise, and often work with a specific patient population. I'm not sure how comfortable or how vague that particular comment is, since again, UCF is one of the largest in our area in teaching, and it goes on. And then what you have said also is in not on this particular page. I think Vernon was knocking on the door. Maybe Vernon wants to chime in and hear what we've been talking about and see what he has to say on it. What do you think?
What are your thoughts, Vernon? Remember, you're on mute.
Yep, I do think the standardization of a message would be good, because I think the more you have a lot of different definitions out there, the more confusion will abound. The more you have people confusing the educational titles with the licensure, the more you're going to have people just not knowing what the deal is. They just know, I go and see somebody for my health care, they write me prescriptions, they take care of me, and I go home. So they're not familiar with the qualifications in education and similarities, but differences that exist between physician and non-physician colleagues. And right. I think language matters. I think over time, we kind of have a difficulty with using words consistently. And I think the more we use clearer words, that we say, I see a physician for my primary care, I see a nurse practitioner for my primary care, I see a physician's assistant or physician's associate for my primary care, that would go a long way towards clarifying and helping things improve. I just think we have to be diligent about it. And it's going to take a re-education campaign, because as we've accepted things for so long, it's just kind of been that way. So unfortunately, until we can get, I guess you could say, our colleagues, our fellow care professionals on board, and then the general public, we're going to continue to have problems.
Right. Well, and like I had said before, I think the messaging needs to come down to what from a patient standpoint or from the general public standpoint, what's in it for me? What am I giving to them? Not what do I do, but what are they getting from me? Because they don't care that you're DNP or that you're ABCDFNG. They don't really care about all those titles. They just care what you're doing for them. So I think again, it comes down to, like you said, a matter of messaging, and the simpler the better.
Well, yeah, I mentioned, but Paul, I'm curious on Vernon chiming in a little bit on read the definition again, because there's so much flack we get, which I say you don't care, we don't care, I understand, but I want to be careful because we're a lot of people can be very strong, and then there's those that may not be as comfortable jumping into the term as it's read from the state level of what we are. Remember when you mentioned what you mentioned? Being medical.
Well, licensure and education versus what we do. And again, Vernon, you did start to touch on that. The licensure and certification to the public doesn't matter as long as we give competent care. So I think the messaging needs to be, what does a nurse practitioner do for me as a patient?
Yes, I think that would be the clearest of messages, because when you see a nurse practitioner, and many people see nurse practitioners all the time, you may not know it. Or I'm sure they've told you, I'm sure it's on their, jackets or scrubs, but you just know the person who cares for you. And I've always been taught that no one cares how much you know until they know how much you care. So if you are providing good quality care, they know that about you more than they know your licensure and your alphabet soup. So I think we just need to be more concise but clear with, this is what I do, this is who I am, and this is how I can deliver quality care but not be a physician. Not that there's anything good or bad about one versus the other. I think we both have our utility, and we both have different preparations and trainings and educations to help get us to where we are. And we all do a great job, as good as we can, I would imagine. But I think we have to let people know, when we go in, each person we see, it's the community that we impact. Hi, I'm your APRN. That's an advanced practice registered nurse. I have my formal training as a registered nurse and additional education to do these things. And I think that would help. But I think we also need to help educate our colleagues as well, because as we get additional education and additional certifications, we tend to put a lot more letters after our name, and that just adds more confusion.
Right. And I think we as a profession tend to emphasize that, thinking it matters to the public, when in actuality, what care those letters bring is what matters. It's not the letters.
So I think, because I know we're getting close up on the time, how do we get, I wanted to reiterate what Paul was saying too, and see if Vernon wants to chime in a moment or so before we, I guess bring this to a close. Getting it out to the public. I'm thinking through the NPs, through us as education is step one, maybe doing the preamble on our letterheads or such that states what we can do, or, what the law states. And then how do we continue to educate the population, the general population?
Vernon, what are your thoughts on that?
Sorry, could you repeat the question?
How specifically to get the information and the education out? Lon was saying maybe to educate our members and constituents with consistent messaging, maybe on our letterhead, those types of things, and then a specific message to the general public.
I think that'd be great. I think there does need to be a tailored message there, and I think it likely will have to be a little bit different because some of the jargon that we utilize for our healthcare colleagues, they'll get, but the general public might not necessarily understand that. Keeping it simple, but still providing clarity about the training, the clinical hours, degrees, I think would go a long way towards appeasing people's concerns in that regard.
So we need to talk education and or communication or marketing division of the organization and see if we can give them like the basics and then have them start putting that on letterhead, etc., so that we all can be like standardized, or no?
I don't think on letterhead's going to make.
It's for us first, and then goes out, and they start talking.
But on letterhead, you're going to need a couple paragraphs for what a nurse practitioner is and does. So I don't know the letterhead is a place to address that, because there are multiple sentences for what we can do, which was going to bring me to my next question. How would the two of you describe what a nurse practitioner can do at a patient care level versus a family practice physician, and make it in 5 sentences or less?
I'm going to start, if a primary care physician can do it within an office setting, and that's kind of broad, then it is more than likely, if you're comfortable doing that, you'll be able to participate and or do that.
Remember, you're talking to a patient. So put it in the context of you're talking to your patient and educating them what you do as opposed to a physician. Why should they see you as opposed to the medical doctor physician?
Access to care?
No, in their terms, what are you giving to them? Access to care. Big deal. I can go see the doctor. What are you doing for me?
The same as I hate the word same. I'm providing treatment, providing care, follow-up, management of you as the patient.
Okay. Vernon, how about you? Remember, you're on mute. There you go.
Yep. I would say we share similar responsibilities in that we're focusing on the care of the patient. There's just a difference oftentimes in the approach. So when I'm talking to patients, I say that our physician colleagues are medical scientists. They receive more training in the scientific minutia of things. So they have a lot of education and training that helps them understand the problem that happens to be in a patient. Whereas nurse practitioners, as nurses first, we're trained to treat the patient who then happens to have problems. So when I look at that, it seems like it's simply semantics, but it's a matter of treating the whole of the person versus focusing on the specific clinical concerns. So if I were to look to brevity, I would always say that our physician colleagues are medical scientists who are trained to treat the problems in the patient, where we as nurse practitioners are trained to treat the patient who has problems.
That's an interesting way of putting it. A lot of times when my patients ask me, especially when I first go to see them, they say, "Oh, you're not a doctor." No, a doctor is an educational title. So I first start out with that part. And I'm not a physician, but I can provide the same medical care as a physician. The only basic difference as far as what I can give you is, in the state of Florida, I cannot write Schedule II narcotics. And yes, there are nuances to that, but I don't go into that because it really doesn't make a difference to the patient. So I kind of leave it at that I can do pretty much anything a physician can do except provide you Schedule II narcotics. And that kind of gives them the idea of what a nurse practitioner is, because ultimately We should, as this Cleveland Clinic definition states, we share many of the same duties as physicians: perform physical exams, diagnose, treat disease and other conditions, and prescribe medication. So that's pretty much what a physician does. In the state of Florida, the only difference being that nurse practitioners cannot write Schedule II narcotics on a consistent basis.
Well, now you're bringing into maybe another session where we're talking about full practice authority within the state versus where we are currently.
No. A nurse practitioner at any level, autonomous or tethered, can perform the same duties as a physician, except we can't write Schedule II narcotics. We can't write them. If you're tethered to a physician, the physician has to write the prescription or co-sign the prescription for it to get filled. That goes into semantics, which the patients don't give pardon my French, a rat's ass about.
I knew it was that. Agreed.
True. Usually, I tend to use the definition that Lon would use, which is when they say, what can a nurse practitioner do, or what can a physician do that's different than a nurse practitioner? And I say that our scope of things that we can do tends to be a bit more specific. So it is not unlimited. We can do the things we're educated and trained to do, but beyond that, there are limitations. So if it can be done in an office setting, the diagnosing, treating, prescribing typically would fall under both. If you're speaking of additional surgical kind of things, outside of additional specific training, nurse practitioners do not commonly perform surgical procedures. There are some caveats to that if you're looking at small skin type surgeries, but typically they're very superficial. So we tend to stick more to the medical model of diagnose, treat, prescribe as to surgical and procedural performances. But that being the case, nurse practitioners can, with additional training and certification, do a lot of those. So the line is often blurred, but that's because the more you get into it, the more specific you have to be about what things one can do and not do. So I tell people oftentimes that physicians have a more unlimited scope. They have a bit more freedom to do different things based on their education, but they still also require certification and training. But there are certain things that, a nurse practitioner is not a surgeon. Physicians can be surgeons. NPs cannot. We can assist in certain ways with surgery, but that requires additional education and certification. So
but to the
it's
same
complicated.
point, but to the same point, same for physicians. A family practice physician cannot be a surgeon without going through a surgical residency first.
That is true. So there's certain things that, depending on the specialty that you work in, that would be a thing. In the primary care setting, it is very similar in scope. If you get into specialties like cardiology, gastroenterology, dermatology, there are some things that broaden a little bit differently. But it does ultimately come down to specific education and training. Not all physicians are trained the same because there's different levels of, residency, fellowship, clinical hours. So the family physician is not trained at the same, to the same extent that a neurosurgeon would be trained. The residencies differ in time. The clinical hours differ in time. It's just less schooling. So, trying to compare, oftentimes it gets blurred because in an effort to show how, wide a chasm would be, there are those who seek to diminish the nurse practitioner's education and training, and they would compare a nurse practitioner in the primary care setting to a neurosurgeon with regard to clinical hours. So there are ways that don't necessarily clearly help in educating patients as to what we do and what we can do. At the end of the day, we both are highly trained and educated to make a difference, to diagnose, treat, prescribe, provide efficient and high quality interventions in care. So letting people know about the difference in the letters would be a thing. Letting people know about the types of care that can be provided. I think you would need to be clear with who you're comparing, because, apples to apples, primary care nurse practitioner versus a primary care family practice physician is one thing. Comparing a primary care nurse practitioner to a cardiothoracic surgeon would be a different thing.
Right. And the same goes on the other end. Comparing a cardiothoracic surgeon to a neurologist would be massively different in their scope and training education.
That is true. Ultimately, if you're looking at it, if you're seeing a neurosurgeon, I probably wouldn't want the neurosurgeon to do something having to do with podiatry. So
Right.
specialties matter. It's vitally important. You can be very brilliant at replacing you can be a heart surgeon or a, transplant surgeon, but it doesn't mean you are highly trained in all things. Eventually, specialties exist to specialize. There is simply too much education and knowledge out there medically, where the old school version of one clinician taking care of everything for you isn't a thing anymore. There's just too much to know. And that's why specialties and subspecialties exist.
Well, there's a lot of chatter out there. There's a lot of chatter that's going on about the 5-year rule, which I don't think is going to happen. But again, like some of us are, and they're talking more about critical care because you get the independence, ER, critical care type things. You're more independent, therefore you're more able to perform on your own, per se. It's a lot of chatter. It's a lot of education a lot of us have. That's also another viable thing that talks about at our levels what's going on, what you're seeing and working with.
Right, at our level. But as far as a patient or public education, again, I don't think they care. I don't think they care that I come from an ER for 30 years as compared to what am I going to do for them? Because as an ER nurse, I can't do squat for them unless they're in an ER. So it doesn't matter to them. It matters to us. And ultimately, it does matter in the care we're going to provide because we bring all that knowledge and education and training with us. But it doesn't matter to the patient. They just want quality care.
And that's agreed. And that's what we do. And that's exactly how we formulate our patient.
So let me ask you both a direct question on this. What do you think, and obviously we can't make a decision for, number one, the association or the state or on a national level, but what do the two of you, can the three of us come to an agreement, a consensus on a simple definition of a nurse practitioner for the general public? Is there a simple way of putting it to the general public what an APRN is from their point of view?
We have three different backgrounds. So we bring,
but from the public point of view, point of view, what can we tell them to educate them? What is an APRN or what is a nurse? What's the difference between an APRN and a nurse practitioner? And then what do they do for me?
So I would define nurse practitioner as, a nurse practitioner is an advanced practice registered nurse, to put it in the definition, who has additional education and training, allowing them to diagnose and treat medical conditions, prescribe medications, and provide a wide range of healthcare services. NPs can work independently or in collaboration with physicians, depending on state regulations. So I would say it's put, and people will then ask, okay, what is an advanced practice registered nurse? Because I always believe in kind of leading into a next question or kind of getting people to ask the next question.
Right.
So looking at, that, I think that would be clear. It tells people what you can do. It tells people there are those that can work with physicians. There are those that cannot work with physicians, without getting far into what autonomous practice is at the legal level or not. Now, if you look at, a simple definition of APRN, I would say that, an APRN or advanced practice registered nurse is a registered nurse with advanced education and training in a specialized area of healthcare. So APRNs can diagnose and treat medical conditions, prescribe medications, and perform those other healthcare services. But specifically, in APRN, when you see that, that is a umbrella term for advanced educated registered nurses. So that means that you can have an APRN that could be a nurse practitioner. That's what the majority of them are. You can be a nurse anesthesiologist. You can be a nurse midwife, or you can be a clinical nurse specialist. Now, of course, I would say, a nurse practitioner, a CRNA or certified registered nurse anesthesiologist, a certified nurse midwife, and clinical nurse specialist. Because there are some confusion between, certified nurse midwives and just midwives. But those are all things that those in the clinical realm would likely know the difference of. So I would say, yeah, it's oftentimes you just have to use it and try to simplify it into, here's what we are. We are all nurses with additional education and training in different things for different reasons. But that would be the clearest way I can think of it.
No, I think it explains exactly what we've talked about and we continue with. And so therefore I hear, Paul, do you agree? Because that's kind of, I think, what all of us are saying.
Yeah, I think the very beginning, Vernon, what you said is exactly perfect. We are nurses with advanced education and training who can provide specialty care to include, diagnosis, treatment, and medications for medical and traumatic problems, and kind of leave it at that, because that's what we give to patients, and allowing it as an open end to have them ask more questions. Well, can you perform surgery? Okay, now you can go down that road and talk to them about that. Can you provide psychiatric care and go down that road? Can you give me my narcotics? Okay, now I can talk to you about that. But leaving in general that we are basically performing the same functions as a family nurse or as a family physician would, from that standpoint.
That sounds clear to me. And if there are additional things sought, if there are additional points need to be clarified, we can certainly work on that. But each person's going to come into it looking for a different kind of answer. And as their level of care differs, so should their, clinicians. Their care team was really designed around what they need. So at the baseline level, although we both take different clinical paths, we both end at the same, finish line, which is providing competent, high quality clinical care to the populations that need us.
It's evidence-based. It's with the grand theories and the general theories that we've talked about, learned and studied. It's within those frameworks, the underpinnings of what our education continues to be. And I think it's a clear, defining initial baseline that we can stand on.
All right, cool. So that may be something, excuse me, that in the relatively near future, it's not like we don't have anything more to or better to do, but something else for the association to take on, to come up with a consensus statement on what is a nurse practitioner from the point of view of the patient. Because again, I believe, and I think both of you can kind of understand this, we can talk all day from a clinical standpoint and from a alphabet soup standpoint to our peers about what nurse practitioners are and what we do. We all know what we do. We went to school for 6, 8, 10, 12 years, depending on how long you whatever course you took to get there. So you know what we do. We all know what we can do. We need to start patting ourselves on the backs in general as a profession and start talking to the public in their terms and what we can provide to them, because I think that's where the message has been lacking. And I think that's someplace that as an association, we can again take the lead and start providing a unified message, at least in the state of Florida, as what a nurse practitioner is compared to an APRN, and what we can do from a clinical standpoint for patients.
Very well said, Paul. I like the way you said that.
Indeed.
All right, so
Boy, I see a large group of I see more and more of these podcasts continuing with the questions and answers and such. And make sure, I was going to say, during this particular session, I think we want to make sure everybody votes today. I wanted to make that some little statement.
okay.
That's all.
All right. So actually, this podcast will probably be coming out after Election Day, but duly noted. So look forward to something from the association relatively soon, probably within the next 3 to 6 months, as a consensus statement on what nurse practitioners are and do and provide to the public. And gentlemen, again, thank you for the time. I know we ran a little bit late, and I appreciate you giving me the extra time. Again, Lon and Vernon, both of FLANP's board of directors, I thank you for your time today.
Thank you for having us. I thank you. I really appreciate your time and doing the same thing. God, it's wonderful.
Indeed. Never a problem. Look forward to hearing from you in the future.
So, like I said, that was a wide-ranging, long discussion on the title of APRN, nurse practitioner, that entire realm, what we do, what we bring to the table, and our messaging for that to not only each other and the general public. If you have any thoughts or would like to have any input on this, please feel free to reach out to the association. Our website is flanp.org. You can contact us through there. You can contact any of the board of directors directly through there also. We would like to hear back from you. What do you think on this topic? How do you feel we should, as a profession, present ourselves and educate the public as to what we do and what we bring to the table? Should there be a standardization in our licensure and titling? Should there be a separate legislative component for how we address ourselves as autonomous nurse practitioners versus nurse practitioners? And what should that be? We would like your input. We're here to support you and to be your voice in this state. So please reach out to us and let us know. Again, this is Paul Bond, APRN, for the Florida Nurse Practitioner, a presentation of the Florida Association of Nurse Practitioners. Thanks again for listening, and have a great day.